welcome to Jack, because he's, meeting is now streaming live on YouTube. Well, that's really good.
Okay.
I think that most of the people that will be turning up probably already have turned up. So Jack, would you like to tell us about where you are now?
To become so let's start. I was an ordinary general adult psychiatrist, which is to say that I particularly concentrated on serious mental disorders. But if we have to go back a bit, because to be a psychiatrist, you have to be a doctor, and to be a doctor, you've got to go to school. So I went to school at Westcliff High School for boys, and I went through the levels there, all these sort of prefect and house captain and school captain, and eventually came out the other side with my 3 A levels. Now, sadly, because no one had advised me, and it might have made a difference, I never got into any of the London medical schools. But I was in a bit of a hurry, because if you think about it, it was Korea time. And if I didn't get to a medical school, there was a risk I'd be called up and sent to Korea. So I wrote round to every medical school in the country, and Birmingham said, yes, you can come. But it was a very unusual school I went to, because they allowed me to, I started a Jewish service in 1948, which, if you think back, was a pretty disordered time in Britain at the time, as regards Jewish matters. But we carried on that, and that's still remembered, actually, as an achievement. I doubt if they still do it, because school might have changed somewhat then. So there we are. I was off to Birmingham. Now, that was okay. I got on the train, and as I sat in the train, the inspector came along and said, are there any doctors or medical students? So I put my hand up, because I thought, well, I'm a medical student. I mean, I actually haven't got to Birmingham yet, but, you know, why not? So there had been a train crash at Weedon, and there were 15 dead, 35 injured. But the inspector soon sized me up, because he said, well, why don't you go and sit next to that chap? He's injured. And that's, you know, how I spent my journey to Birmingham, getting to Birmingham. So eventually, and I can't remember how it happened, but presumably the train went back and we did some detours, and I got to Birmingham, where I was in digs with a chap called Tony, who's currently in America, and with whom I'm still in connection. And he, I mean, just to put it to you about the link with Palestine / Israel, his mother had arranged for a Dakota to be transported from London to the Middle East, and that's what her achievement was. My achievement was we gave hospitality in my house to a chap who was on his way to Israel, Palestine. That was 1948. And off he went. But about 6 or 7 weeks after he left, there was a notice in the News Chronicle that he'd been executed for being a spy.
Oh.
Yes, well, I thought, what was he thinking of me? So anyway, there we are. There we are in Birmingham. There is not a great deal of psychiatry, there wasn't a great deal of psychiatry in the syllabus at the time. But one thing that did happen was we had a chap called Meyer Gross, who'd written a textbook, and he wanted to try out the effects of this new tablet he had. So he asked for volunteers. and Julie will know what the ethics are, but he said, I want to give you all LSD. So he gave us LSD, and then the next time we took the LSD with his antidote, and it worked. Well, that was quite interesting because it was a case that abnormal symptoms could be determined by deterred or eradicated by taking tablets. So that was as far as it went. So I went off to, after I graduated, I went off to do my junior house jobs, one with an anti-Semite, the surgical one, who spent the whole of the 6 months I was with him telling me anti-Semitic jokes, which, and I thought that was rather amusing because he couldn't tell one when he saw one, you know. So anyway, I didn't take it up for obvious reasons, but I went on to do my national service. And the national service had 3 points of interest, as far as I was concerned. Let's start with the most startling. One day I was stationed in Kingston, and there was a WRAC barracks in Richmond Park. And part of my job was to look after the WRAC. Well, one day they rang up and they said, well, there are these women here who have been brought in from East Germany. So I had to see them because on posting, you have to see the doctor. And I said to one of them, what's all this about? She said, it's restricted, I can't talk about it. But it was quite clear that these were girls who had been tapping the wires in the tunnel in Berlin, which had been betrayed by a chap called George Blake. I don't know if you know anything about George Blake, but he was a notorious spy. He was sentenced to 42 years imprisonment by the judge, which is the longest sentence anyone has ever had. But someone threw... security was a bit lax. There were 2 things about it. One is that he had a walkie-talkie that he used to talk. Somebody outside had a walkie-talkie. I used to talk to him to make the arrangements for his escape from the prison, Wormwood Scrubs. And one day we threw a rope over the prison wall, which he climbed, and found that there wasn't any arrangement for him to descend on the outside. So he jumped, broke his wrist, and was taken by his friend then to a place about 3 minutes away from Wormwood Scrubs, where he was kept for a while, and then eventually got to Russia, the Soviet Union, and has only just died there. So that was item number 1 of my experiences in the RAMC. The next one was they had a rifle shooting competition with the infantry officers, and they said, come on, Jack, have a go. And I came away with a tankard, and a crested tankard, because I'd fired my gun so well. Oh, it was a rifle, but it wasn't a 303, it was only a 2.2. So that was nice. You should, as you know, there was the question of the King's shilling, and in the 17th and 18th century, if you took the King's shilling, you were recruited. So what the recruiting sergeants did was they gave you a tankard of beer and put the shilling at the bottom. So once you'd had the beer, you were in the army. But that's why there's a glass bottom to all these pewter tankards, so you can see the shilling. So that was another one. And the other one was that I spent some time with the lifeguards. Now, but we're a bit off the topic of psychiatry. We're coming to it. So the lifeguards are, I expect you know, those are the people with sort of the colour, the shiny yellow helmets and the plumes and the great red cloaks that accompany the Queen on ceremonial occasions. And they are the military descendants of the aristocrats who accompanied Charles II until he was restored. And so they have pride of place. So I went there for 2 or 3 weeks to do a locum for the doctor who was there and taking his leave. And it was a most amazing experience. They were aristocrats and quite well-to-do, very friendly. And I don't know if Leonard's there, but normally in the regiment, you have a dinner night once a month. But in that regiment, that brigade, they had a dinner night every night. So every night, the table was about, call it 20 feet long. They put out the silver and they had 2 mess waiters. And the point about it was everybody else signed themselves out, but I couldn't because I hadn't the money to do it with. Secondly, I hadn't any means of transport to get to London where they were off to. So I sat in solitary splendor, attended with all the silver and 2 mess waiters. And I'd sit through with my dinner jacket because that was permissible if you were national service. You didn't have to put on full dress uniform. And then at the end of the meal, I had to go back to my room, wash my white shirt out, the nylon shirt, have it dry for the next day so I could be clean. So they were lovely people. They said, do you ride, doctor? So I said, no, I don't. They said, well, go and see the riding master. When I went to see the riding master, they were enormous horses. I couldn't see how you could possibly leap onto it. So I didn't do it, but I found out afterwards they have a thing called a mounting block, which is a sort of ladder. And you go up there, if you kind of get on the horse, you get up the ladder and sit aside the horse then. Anyway, that was an experience. They were lovely to me. They were very kind. And as people who know they're at the top are always kind to people who are not really in competition with them. So off I went. Now, after my national service, I wandered around looking the various hospitals of various specialties for a while until I happened upon a job at the Tootingbeck Hospital where I went to consider my options. And the chap in charge of that was a chap called Thomas Bewley. It was a hospital for senile dementia. He'd taken the job on and then opened an alcohol unit. Anyway, I worked there for a bit and he thought he could recognize a good chap when he saw one. So he sent me over to Springfield Hospital, where there was the deputy superintendent was a very nice Jewish chap whose son is a member of the Richmond Synagogue and with whom I've communicated. And we got on very well. So I did also, so the thing about the spoons was all the spoons in the hospitals were marked SCLA. And because Springfield Hospital, meaning the Surrey County Lunatic Asylum. So you knew where you were. So that's where my psychiatry really started. I got on like a house on fire with that man. And I did sort of behavior therapy. I opened wards by the following means. They were all lot wards there, except 4. Aster, Bluebell, Crocus, and Dahlia, if you can see the reasoning. And but I went up to these wards and it was not at all obvious to me why they had to be locked. So the behavior therapy, I said to the nurses, the staff, the charge nurse, why don't we just open the door about a foot for 5 minutes. And then after a week, I'd go back next week and say, can we have it open a little bit longer? And then for a little bit wider. At the end of the time, the door was open. So that's the only time I've used behavior therapy in my practice. But it worked. The other thing that I did with in that job was that the deputy physician superintendent had been much criticised when he gave up insulin coma treatment for schizophrenia, and he'd done a short survey. But I thought it'd be a good idea, as it was 10 years on, if we could do a 10-year follow-up, which is what we did. So it was a 10-year follow-up of 100 first admission schizophrenia patients, which you couldn't do now. You couldn't collect them. You can't get first admission. You know, they're uncollectible. So that was published, and that got me off to a good start. And I went from there to working at St. George's. Got a job it was then the Atkinson Morley, where the psychiatric unit was, and got on quite well there. So that was a job as a senior registrar, which is the top training grade. And after I'd done my 4 years, they said, well, your time's up, we can't extend it, but would you like to become a locum consultant here at Springfield? So that was obvious. So I went back to Springfield as a locum consultant. I haven't mentioned the dry humour that deputy superintendent had, which was, I said to him, is that consultant there, does he drink a lot? He said, it's dry and wet with him. So he took tablets as well. So we moved on from there. I got the job then of between waiting to go to Ealing, and that was a permanent job, and that's when I started the fundamentals of my career again. I worked at the place called King Edward, which was the old King Edward Memorial Hospital, little hospital, but they had built a district general hospital, the Ealing Hospital, in the grounds of St. Bernard's Hospital, where I was a psychiatrist. So I went over there and became chairman of the district management team for the given period of 4 years. It was quite a big budget. It would be sort of tens of millions. And I quite enjoyed that. At the same time, I was setting up the service in St. Bernard's Hospital, originally the Handel Asylum. And we had enough money to build a new unit, and that's where the good work started. There were 4 new consultants, all of whom were, as it were, of one ilk, and we built this unit with 16 bedded wards, mixed because they had 2 8-bedded wards adjacent to one another. But every patient had their own room, which was something you didn't often see in a psychiatric unit in those days. So it started from there. I was the chairman of the medical committee there, so I divided our catchment area up into 4, so the units were streamlined. We had community psychiatric nurses to each catchment area and consultant and ward, and social workers ditto, and the GPs, of course, would know their way around that. So it was a considerable advance. Now, and all the time I was there, not all the time I was there, but most of the time I was there, I didn't transfer any patients out to long stay wards. I didn't have any suicides or attempted suicides. So, and these were people of unrestricted people on sections and some informal, but they were all quite, I mean, the basic rule was you didn't come into hospital unless you were quite disturbed. We arranged that the letters went out the day following, that there was no waiting list to see anybody, to see a consultant in the community. And that had an interesting side effect, because somebody would get an appointment from the GP to come the next day, but they'd often not come because they were too sort of shocked by the idea that this could have happened, or this could have happened so soon. So what actually happened was that instead of seeing the consultant, the community psychiatric nurse would make the visit, and they'd be seen in their own homes, and that was a definite advantage. So that was one thing we did. Then the next thing was a friend of mine from Westcliff High School turned out to be the professor of psychiatry at St Mary's. So we arranged rotational training schemes, quite a novelty then. And they became very popular because the trainees would go to the teaching hospital and take a turn in the St Bernard's, and it became very popular. And it was a great advance on the sort of rather desultory staffing that was present when I arrived. It was sort of desultory in the sense that there were they were then called senior registrars, and the senior registrar came from Australia, and when they left, they'd hand it on to another visitor from Australia, and it was a sort of Australian. It was a gift to the Australian medical profession, but not what it should have been, because they only came for the holiday. So that was that. They had, when I got there, they actually had a padded room. So I said to the senior nurse the senior nurse came, I said to the senior nurse, it's time we took that padded room out. And he said, well, I don't know, can we have a compromise solution? So I said, that's fine. We'll take the padding out on the floor and halfway out the wall, and then you can have the padding halfway out the wall and across the ceiling. And that would, he sort of rather got the point. So that was the end of the padded room in that place. Yeah. We did, between us and the chaplain at St Mary's, we did a lot of drug trials, and that became one of the, that was a great advantage. First of all, it taught the junior doctors how to rate rating scales. And the other thing was we get money to get extra staff, and also money which would pay for international conferences, so-called. That all went, you may wish to know, to St Mary's Hospital. I didn't touch it. So that was quite an advantage, and we had, I mean, those junior doctors enjoyed it, and then remained a popular posting throughout. So the other thing we did was we got an interim secure unit. And that was for people, that was forensic units, or low category forensic patients who committed some sort of crime or other and were detained by law for that reason. And that led eventually to the West London Mental Health Trust taking over Broadmoor, which it did. So it had a long fuse, but eventually it turned out well for Broadmoor and well for the trust. Later in my career, I did private practice. You could go maximum part-time, so you lost a couple of sessions a week of pay, and then you could see private patients, and that was the deal. I started by going up to Harley Street, but then I realised after a bit that my patients were all coming from Ealing and coming up to Harley Street, and I was going from Ealing to Harley Street, so that wasn't very clever. So I took some space at a place called Old Court Hospital, and that was quite interesting because the only other doctor working there was a chap called Magdi Yaqub, who was doing heart transplants. So they had this little clinic in Ealing, this chap doing heart transplants and me doing psychiatry. And I didn't realise until he retired and I was invited to his farewell dinner that it was a very important part of the deal, that there was someone on site who was doing another specialty. It made a hospital out of it rather than a clinic. But, you know, that was all part of the excitement. Motorcyclists would turn up with a big Red Cross bag and rush into the hospital. Those are the hearts. So that was good. I enjoyed that. I also worked at the Priory Hospital, where the treatment was the same and the food was better. I was once asked if one of my patients, who had actually come from abroad, was good for, she did give them a credit card, was good for her money. And I pointed out, so I was quite sure it was true, that she had enough money to buy the hospital, never mind pay the fees for attending it. And so they retired and said, well, that would do. So that was all part of that. Then I've got a list here of jobs I did. I was on the college council. I was on the public policy committee. I was on the political abuse of psychiatry committee, which was to do with the Soviet Union locking people up, putting them in mental hospitals when there was nothing wrong with them mentally. We had such a person left with us in St Bernard's, and I rang up a chap called Gary, and I said to him, all this chap does, I said, he just goes for walks and he looks in shop windows. And Gary said to me, well, I'm retired and that's all I do, so it's not much to his detriment. Gary had Picassos in his house. Everyone he was famous for. So then for 5 or 6 years, I was the regional advisor for the college, which meant that for a quarter of London, I was there to maintain the standards, to advise about standards. And then I became chairman of the regional psychiatry committee, and I was on the higher and lower awards committee, which was also quite interesting. Now, I joined something called the Health Advisory Service. I mean, they asked me to go along to meetings, and we sort of audited hospital work. And you go for, take a team and go for 3 or 4 weeks and see how the place was operating. And on one occasion, the place, we'd always ended up with a meeting and we present our results. And in one case in particular, it was met with silence, and about a week later, they closed the academic unit down. And I didn't point out, but I should have, that I'd actually toned my report down to make it not sound too critical. Anyway, that was that. Then I went to, I did fitness to practice. General Medical Council operates a system where if a doctor's done for drunk driving or something like that, they'd have to see a psychiatrist and present themselves to the fitness to practice meeting of the college, no, of the General Medical Council, and the case will be decided on the doctor's report. So that was quite good. I used to have to fly up to Manchester. You get a cup of tea when you reach maximum flying height, and then the plane would descend into Manchester. But it was quite good fun for a while. And you get all sorts of vagaries of the medical, of the doctor's conduct. I did the same for the General Dental Council, but I actually appeared with the council there. But I hope it won't be taken amiss when I say that they were not so imaginative in their misconduct as the doctors were, and it was slightly tedious. So they were very appreciative, but when I said I couldn't do it any longer, they were really quite upset. So I did a similar thing at the Veterinary Council. I was on the list of one of my instructing solicitors was the solicitor who did the defence of the vets. So I used to go there, and that was quite interesting. There were two interesting cases you might like to hear about. One where a veterinary surgeon was in trouble because he'd castrated a hamster and killed it. And I was asked my opinion about the vet. But I got him off on the grounds of diminished responsibility. And the other one was a vet who got into serious trouble because, as he explained to me, someone had taken a cat to him to destroy and had rung him up while he was in his car on his way somewhere, saying, "Have you destroyed my cat yet?" And he said to the person, "To destroy your cat, I'll destroy the cat now," he said, and injected it through the bag. That's not so nice, but I didn't find him particularly, fit to practice, and I think he was found unfit to practice, at least for a considerable time. So the other bit of work I did was as an expert witness, and that is quite interesting. So expert witness means someone makes a claim against an insurance company, and the solicitors acting on behalf of the insurance company instruct its experts to see what the report is on the aspects of the case. So that was quite interesting. What the general rule was, for instance, I got to do a lot of defense work because I was meticulous and detailed and hardworking, and the other psychiatrists would just write down what the patient said, and sign at the bottom they agree with all that. And that was how the two contrasting reports were received. But what would happen after a bit is, after I had submitted my report, like the videos of people doing things which they had stated quite cogently and affirmatively that they were unable to do. So, for instance, I got a chap who said he was terribly handicapped because he was a scaffolder, and then you get a picture, you get a video of him going to his job of work and taking two scaffolds up the scaffolding, two scaffold poles, and I think that's all right at the end of the case, really. And there'd be a lot of that. There was one marvellous case where a chap said, it was obviously it was psychodrama, really. He said that he tripped on a hole in a park, and the park hadn't been properly maintained, and he couldn't walk anymore, and so he limped into court, all big drama. And it was obvious that it was obvious to the judge what the case was all about. But he said, I don't need to hear any more from the expert witnesses, because in my opinion, it was an undulation and not a hole, and the case falls on that basis. So that was quite nice. So there was a lot of that. I did quite a lot, and got quite a busy practice doing that. Then I did things like Southwest Water. Did anybody remember Southwest Water, when 40 tons of aluminium hydroxide went into the water, the water supply? So the water supply was contaminated. There's no doubt about that. And people were saying they'd got Alzheimer's disease as a result of this contamination with the water. So I had to go to Cornwall, and while we were staying in this inn or minor hotel on the coast, when the waiter came and said, take your order, and he said, are you up for the water case? So I said, yes. He said, well, what you'll notice, he said, is that all the people claiming are incomers. And they really mean it in Cornwall. Incomers are people who've come to retire. They're not Cornish at all. They're sort of foreigners from different part of England. And it turned out really that the ones I saw were all incomers. I was given sort of 10 to see, all incomers. And they hadn't got anything like Alzheimer's disease. And my favourite quotation from that is, I've got Alzheimer's disease, doctor, and I can give you chapter and verse on it. So they had a very good memory for the progress of the illness. And on the other side of Cornwall, they were getting the claims signed up by people in public halls, and there was a psychiatrist on the other side saying this patient has Alzheimer's and this patient had each individual case following examination, or what I imagine is a cursory sort. So that was one sort of expert witness work. I did some abroad. I went to Ireland to do one case, and the reason that I was asked to go was that the person against whom the claim was made was a senior academic in the Republic, and there was no psychiatrist who dared put his or her name to anything criticizing them, because there'd be repercussions if they did. Well, that was all right. I mean, I didn't mind. So we went to court in Dublin, But it turned out as follows. First thing is that the judge came in preceded by a tipstaff, addressed then by the barrister, the Irish barrister. No, yes, but as my lord. And I said to the solicitor, it's a bit odd in the public. He said, it's just tradition, that's what we do. Anyway, to cut a long story short, the judge said he couldn't do it that day because his diary was overcrowded. So all the witnesses decamped to the entrance hall of the court, and the case was heard on a sort of on an open forum basis. It wasn't done in court, but they agreed beforehand that they'd sort of stick to the result, which was satisfactory, and that was that. Then I was supposed to go to Namibia because there was a case originating in that country, but the South African lawyers could see that this was they'd made a mistake, really. The best thing to do was for them to come to London, and they would have the fun and I wouldn't. So they came to London, and they were a bit surprised, really, because I was due to see them the day after the London Underground bombings, and they had said to me, how did I get there? And I said, I'd come on the Underground. So they thought that was pretty good. And that case worked out quite well because I'd seen the claimant. I hadn't examined the claimant, but I'd been to see the claimant. I must have examined been to see her, and she was sort of quite well, really, for a person who'd been through what she'd been through. And they were quite happy at that, and that was the end of that one. So I had a lovely chap who had cases, gave me cases he was in Bristol, and he'd get me down there and he'd say, I've got what I want you to do, Doctor. I've read your reports, very good. We're going up to the court. I'm going up these steps to the court. What I want you to do is to follow me up about 3 steps behind. And I might not go very quickly. So I trundled up behind him quite slowly. And when we got to the top, he said, well, it's all right. He said, I've settled with the other side. And what he'd done, really, he'd sort of waved this London psychiatrist at the other side, and they had said, oh, well, we'll settle then. And that was the end. So I could go home. And he did that 2 or 3 times, but then he retired, which I was very sad about, because it was a day out in the country and not a lot of work, because he didn't actually have to go to court. There's an interest. I got the follow-up now, so we're now at sort of the tail end of my career. I got a letter from Witness Protection the other day to say that the parole board is meeting about Mr. What's his name, who had appeared in court. Who appeared in court, so I can tell you his name was Jan, and they said, do you want to be informed of the outcome of his parole hearing? So I said, well, what's it about then? And they said, well, you've got an entitlement now to know what the parole board says. And this chap was a funny chap because he slashed all 4 tires on my motor car, which was parked outside my house. So I couldn't take it down to the tyre shop. The tyre shop had to come up to me. He had gone round trying to set fire to houses, people's houses, social workers' houses, by burning paper through the letterboxes. He had hit a social worker over the head with a brick. He had made lots and lots of nuisance calls. You could have been in this, David. if you use your LLB, put it to good purpose. So, and he was eventually sent to trial. One of the reasons they caught him was when he rang me with his nuisance calls, he didn't realise, and I did, that if I dialed 1471, you'd get the number he was ringing from. And that was a public telephone watch, so the police watched it and they could work out who it was. He had a gang of people who were doing this. Anyway, so he was in court, and there were sort of about 40 witnesses or something, and he was sent to prison for a very long time. I'm not quite sure. He was given life on them. But he's still there. So I get letters saying, would I like to make a statement about any anxieties I had if he's let out? And they said, it's quite apposite. They said, well, but don't put anything down about any change of address, because, you know, that will give them him a clue where to find you. But the trouble is I haven't moved in all that time. So that's that bit. And the only other thing to say is I've got lots of former colleagues that keep up with me following the end of my career, and they keep in touch, and some of them come and we all go out to dinner. They come from, like, we're talking about Wessex. They go out to dinner, and it's quite good fun. And I think that's really all I've got to say. I'm quite willing to take questions if anybody's got any.
I do.
Yes.
Jack, I'm unclear as to why you chose psychiatry. I mean, you could have chosen any of the other consultancy, areas, pediatrics, anything, why psychiatry?
Well, why psychiatry? Because I was there, I fell in love with it, and it was me, and it was easy peasy. I could do it, and I could do it without the slightest difficulty. That was why I did psychiatry.
Okay.
That was it.
Were you ever involved? I remember, that's my last question. At some point, they were doing electroshock therapy. Were you in practice when that was happening as well?
It still happens, I hope. It's not finished.
Oh
no. People have a very curious idea. I gave out a lot of ECT and recommended it. The first thing is to emphasize the patient is asleep. So you get an injection to put you to sleep. And you also have an anticonvulsant. So you're paralyzed, right? Not anticonvulsant. You have a drug which paralyzes you. And sometimes it's difficult to see if the patient's actually convulsing. So you have to look very carefully at the fingers. But otherwise it's the patient's asleep. It's not like One Flew Over the Cuckoo's Nest.
Jack, can I ask you?
Yes.
When did you retire? How old were you? And did you retire at the normal age, or did you go on a bit longer?
I retired at the normal age, but I went on with the additional work, which doesn't require practice. So I was there until about until I was about 65. Yeah.
Yeah, because I was.
The other thing is, it's all a long time ago. So I'm not talking about these days. I'm talking about my career when I was in practice.
Which year would that have been when you retired?
About 2000.
About 2000, yes, because in the 1980s, I was working at the old Westminster Hospital. I was the head of Department of Clinical Psychology there, so...
Well, that was for clever people. The rest of us had to be the scumbags. Yes. I'm a clinical psychologist. I think there's another one in the audience, actually. Well, a psychologist, anyway.
Yeah. I ask you, Jack, you didn't say much about your family life, your parents, your wife, your family. Could you say a little bit?
Well, it's a story about my career and not about my family life.
It's about getting to know you.
Well, this I just took the opportunity to put in my career. I mean, reading through all this, it makes me realize how much time I had actually spent away from the family, going on these various trips to, the health advisory service. Well, I had a family life. It wasn't any problem. It was just, I just wanted to do this as a change.
Hi, it's Elizabeth. What do you think of everyone today talking about, because I don't know, but probably when you were around, mental health wasn't such a talked about subject, and about everybody discussing it. Is it a good thing that people are discussing it, or do you think people just should get on with it? Or how do you feel about what's going on today?
Is that Elizabeth?
Yes, it is. Hi.
Hello, yes. Did you hear my bit about reporting on a professorial unit, which was greeted with silence, and they shut the shop, and it all moved on because it was so bad. Psychiatry doesn't deal with that. That's sort of that's public policy. It's not. I haven't a view about that at all. I don't think people get on with it. I mean, I think not everybody can get on with it. Not at all. But it's not you can't make a general statement. Psychiatry has got to do with individuals. Mm. I have told some people they should get on with it. Mm. But it's not a general statement.
Mm. Thank you.
Diana.
Hi, thank you, Jack. Very interesting career you've had. What about the closing of the big hospitals and sending people out into the community? Sometimes probably to be neglected in the community rather than being cared for in the hospitals, or not?
The one thing that happened as a result of giving people, mainly people in hospitals were schizophrenic, chronic schizophrenia.
Sorry?
Suffered with chronic schizophrenia.
Yeah.
We made them all better. Not all, a vast number. The hospitals closed themselves. I think there's a feeling that there was a statement made, these hospitals have to close, and then all the patients were turned out. But actually, the patients all left, and someone said, there's all this room and space and money, what we can do with it. So I don't think it applies, really. I mean, we get things, some patients need caring for, but they get that in the community. I mean, we did anyway, and they get accommodations in the community. They get mind hostels and other local authority hostels. I don't think the hospitals aren't a good place to be, actually. Not if you can be admitted to a hospital. The thing to do is to get out as soon as you can, because 40% of hospital admissions are due to the things that you catch in your first admission. That's a general rule. It's true, and the same applies in the same way to mental hospitals. I don't think that. I think they were terribly institutionalized. Where could you go from St Bernard's Hospital for a walk? I mean, nowhere. Nobody took you to the shops. Nothing happened. I mean, you'd have sort of occupational therapy, which was all raffia work and knitting and stuff like that. It wasn't a good scene. I didn't think it was a good scene from the moment I saw it. I thought, it's time it was improved, and it was. So there are several arms to the answer. One is that you, like I said right at the beginning with the research bit, you can't find 100 first admission schizophrenics because they don't last anywhere.
But Jack, when you have a patient leaving hospital and put out into the community, and they say, well, take 3 of these tablets every day, and you'll be all right. And then for whatever reason, they stop taking the tablets. What sort of control have you got over that?
2 or 3. I mean, right. So when I was there, it was a case of you could carry on with the injections, right? Mm-hmm. And so you know if they have the injections. And what you can do is if you think there's a possibility of relapse, you get the community nurses to take a close look and readmit the patient if they need it. And you can do that by operating the Mental Health Act.
Yeah. Well, sometimes it's only after they've chopped somebody's head off.
Mm.
I think chopping people's head off is a rare event.
Yeah.
I never had a patient or even heard of one who chopped their own or anybody else's head off. But yes, Broadmoor is full of patients who've done very naughty things who are mentally ill, right? And so is Moss Side, yeah? So yes, of course it happens. But if you look at the individual cases, you usually find there's been a flaw in the management.
Okay.
That someone hasn't told somebody or people haven't responded to the request for help, usually.
We'll have an inquiry and make sure it doesn't happen again.
Yes, ho-ho.
Question.
Yeah. Hello.
Leah.
Yeah. Hi, Jack. Thank you very much for this lovely talk. I have a question. Now, during your long career, have you noticed any pattern or statistics that mental health disorders or serious mental health problems were rising among a specific age group or community? Was there any pattern that you have noticed? Or if so, what do you think the reason was?
I think if you look at, I dealt with serious mental disorder, which is schizophrenia and manic depressive psychosis, and perhaps post-traumatic stress disorder. But I don't think there's been any change in the incidence. I think there was a case for saying that people who smoked pot got more mental illness or didn't recover so well from the mental illness that they had. So that tends to be a factor, right? But
so you haven't noticed any kind of, you obviously had some background information about these people, about their race or their socioeconomic background. So were there any statistic being kept, or were people trying to also understand whether there is a pattern?
If they're doing that, it's the Department of Health who does it. Okay. I mean, if you're in hospital practice, there's not much you can do. I mean, because you need a broad brush. So the answer is, I'm not sure of the answer, but there are well-known relationships between low economic status and schizophrenia, but it doesn't go any further than that I know about.
Claudia.
I just wanted to make a comment there that it's a bit like crime. It's the statistics are difficult to get at, really. Not the statistics, but the incidence is confused with the the actual incidence in the population is confused with the amount of detection by GPs or other people, who are looking for it, and by policy deciding to do something about it. So it's just like crime. If you have more policemen, you have more crime, because there's more apprehension of criminals if you have more police. It doesn't mean there's actually more crimes being committed.
And also, I think it's quite delicate, isn't it? People do not want to reveal the statistics in case if it's useful, to support some racist ideas, perhaps.
Oh, I don't think, I wouldn't like to think that was true. I don't think people suppress statistics.
No, but I mean, you know, before there were psychiatrists, there was still mental illness. But you know, no one put a name on it, and there was no data about it. That's what I'm trying to say.
No, they did call them mad. That's all right. Yes, Leonard, would you like to say something?
Yes. Good morning, Jack.
Morning, Leonard. Nice to talk to you.
Thank you for that wonderful talk. Sheila sends her apologies for not being with me today. Without stealing your thunder, can I tell you an anecdote relating to an experience I had as a medical student at Charing Cross Hospital?
Oh, right. Go ahead.
When we were doing our training, we had to do a 6-week psychiatric firm. So we followed the psychiatrist around, and one of his great interests was transgender, but that's by the by. He had the idea that we ought to get to those psychiatric patients at close
quarters.
And he took us on a Saturday morning to Shenley Mental Hospital in North London.
Yes.
And he led us loose into a room where the patients were wandering or sitting at tables. And I was allocated to a patient sitting at a table. I went over to him with a cup of coffee and I said, "Good morning, how are you? How do you do?" And the next thing I knew, I was lying dazed on the floor. He thumped me one.
Well, that's Shenley Hospital for you. That's all I can say.
So I didn't take up psychiatry.
No. But if you're asking, I had never had any violence shown to me at all, ever.
No. Well, I had nothing against him, and presumably had nothing against me. But
No, it's a matter of how well treated your patients are and how carefully they're observed.
Mm.
But my experience of it was, although there was a risk and you had to take it into account, but all the patients who came in were going to go home. I'd only got 16 beds for the whole of the whole of the country, the whole 56,000 people in Ealing West 5.
Did you know Dr. Yuri Baruch?
Yes, I knew Dr. U.B.H. Baruch. Yes, I did.
St. Bernard's was my local mental hospital.
Yes, I mean, he was a very nice chap.
Mm.
Yes, why do you ask? Just that I know him. Yes, he was on the staff.
You mentioned St. Bernard's, and I used to refer patients there.
Well, yes. I mean, he was. Yes, I mean, yes, he was a colleague. Mm. His son went into psychiatry as well.
Really?
Mm-hmm.
Yeah.
Did you ever get to? Were you ever involved with Coney Hatch at all, Jack?
Which was Coney Hatch? Is that
the one? Coney Hatch. I understood Coney Hatch was a mental hospital.
I think that was well, no, I wasn't.
Okay. Yeah.
I've named all hospitals I was associated with and that have seen the front and back of me. No. I mean, I think I've been trying to give the impression that psychiatry is rigorous, helpful, and if you work hard at it, no, not particularly hard at it, you get a good outcome. I mean, you know, everybody who goes from, say, St. Bernard's goes with a plan. I mean, they just don't leave, asked to leave. You get a plan with a doctor, a GP, and a CPN, and a social worker, and a place to live. You're not allowed to send people home without all those things.
Mm. Any more questions to Jack?
Can I ask Judy?
I have a question.
Okay. In a moment, then.
I just want to say that you know, in your account, I think you said you decided you wanted to be a psychiatrist, and then in order to do that, you needed to study medicine. But what about, but, you know, I suppose many psychiatrists studied medicine and they looked at all the specialties and they chose psychiatry. But, you know, well, I sort of witnessed a decision process by a young doctor about what specialty they might do. Yes. And one of the criteria, important criteria, was, you know, which specialties could they be most effective in and really sort of help people. And though they were they found psychiatry very interesting, like in a rotation, they felt that it was one of the specialties in which you could actually cure the least people, the least proportion of patients compared to, you know, I don't know, orthopedics or endocrinology. You can really sort of help them. But, you know, it would be sort of, well, depressing, if I could use that word, for some young doctors or doctors that they really, there's such a low cure rate really in psychiatry. So you'd have to be okay with that.
Claudia, have you done?
Yeah.
You've talked me out of it. Well, wait a minute. There's several qualifications to what you just said. And one of them is, well, if everybody said, oh, psychiatry is depressing and miserable, there'd be no psychiatrists. So I think it's a little bit like, not all, you know, I had a friend at medical school who went into cosmetic surgery, and he made an awful lot of money doing breast implants, and he made a lot of people very happy. But I couldn't do that job because I'm no good at it. So no, I did a job which I could see I was good at. But you've got to have people who, you know, it's a very broad spectrum is medicine. And I don't think, and if people don't want to do psychiatry, that's fine. But I don't see the criterion is how many people I can make better. Why don't you, how many, but I get a very negative response, you see, because I think I made a lot of people better in my time, and they had a good experience while they were getting better. I mean, while they were having treatment with me.
Good.
They did.
Good. Yeah.
Jack,
sorry, Jack, did you want to ask Judy something? Did you say?
Yes, but only, hello, Judy. Are you there?
She's there, but muted, yes.
Yes, I'm here.
Yes, but was not one of your jobs with Mind?
No, I was Chief Executive of the National Schizophrenia Fellowship.
Well, then, come on. You must have something to say, Judy.
Well, I mean, I was at the Schizophrenia Fellowship in the late 80s, and we were very unhappy with community care proposals because what we found was that people were being chucked out of hospital with insufficient care in the community, mostly negligence in the community. Mm-hmm. And also the other experience at the Schizophrenia Fellowship, the reason why it was parents and families who'd come together is that at that time, the attitude of the health services was, until your loved one is really, really ill, we're not going to take any notice. And I'm afraid quite a lot of people became very ill. A number of our members suffered, you know, personal results. I mean, people died. I remember particularly one family ringing me up and saying, we think our son's going to kill us. I contacted the police, I contacted the psychiatrist, but it didn't help. They did get killed. So it wasn't, it was a very serious situation, and a lot of elderly parents who cared for their loved ones with schizophrenia didn't know what was going to happen to them when they died, when the parents died. Mm. I do think it has changed a bit. There is now much more emphasis on early intervention, and I think that some things have improved, but I don't think I could be quite as complacent about it as maybe you seem to see it from a happier perspective?
Well, only because it doesn't tally with the sort of work that I did. That's all. I mean, I never sent anybody out. I mean, you couldn't. We were sort of what's the word, crusaders. You show me a schizophrenic, I'll put them in the section and admit them straight away if necessary. I mean, we're enthusiasts. I mean, I wasn't going to have any of that sort of nonsense going on, telling people there were always beds, there was always vacancies. I was enthusiastic about treating these ill people.
Well, that sounds good. It wasn't everybody, unfortunately.
No, well, that's the problem, isn't it? I mean, that if you're working on a national basis, you'll get to hear the worst cases first.
I think the other thing was that it did seem like each psychiatrist was the Lord in his or her own manner, and some of them behaved very strangely. Not all of them. Some of them were great, but some of them were really, it was incomprehensible the way that they behaved to me anyway.
Well, yes, that's why we need to recruit the best people into psychiatry so that it's not only the patients that are abnormal.
Can I ask you a question? I could never quite work out why a psychiatrist needed to be a doctor.
Oh, we've had that discussion, Judy. We had that discussion. I remember you pulled my leg on it before. It's yes. Because, do you remember? The
yes,
answer
I do,
was, yes, okay. So brain and mind are related to one another.
Yes, but I mean, clinical psychologists also do a great job with people with mental health problems.
They can't give them. Yes, of course they do. I don't say that.
They can't prescribe the drugs, but you could link in with that.
I think clinical psychologists do a wonderful job. They can't give injections. That's all. So if you need an injection, I can do it because I understand about needles. Yes, I mean it's
okay. I think
trying to ask a question. I've had my hand up for about quarter of an hour, David.
Sorry, Neil.
Hello, Neil. It's lovely to see you. I haven't seen you for such a long time.
I was about the same thing to you, Jack. You're at the beginning. You sketched over a lot of things, but you gave the impression that you were sort of a radical liberal in your early days. Can you say a bit more about when you closed the padded room? Can you tell us what they were using their room for before you went and how they dealt with those situations after you'd closed it?
Well, I wasn't there before I went, but the padded rooms were used for dealing with disturbed patients and violent patients when you had no other means of controlling them. Now, I wasn't there in the days of the padded room. I was told that the main disadvantage, apart from the ineffectiveness, was that you couldn't heat them. So, because the rubber would melt. But to me, it was a symbol of the old days. You know, I mean, it was. How did we deal with people? Well, we gave them medication. Didn't need it. I mean, as I said, I never moved a patient out of the admission ward to any other ward. Brackets, except at the very end when they took all my nurses away, but that's another matter. When I was there, no patient was moved out. There was no need for it at all.
Good. Okay. Anybody else like to add anything? Or shall we say thank you to Jack for his interesting talk? So maybe Jack will get you back to do another getting to know you, this time on a family basis.
Yeah. Thank you, Jack. Thank you very much. Thank you.
You're very welcome. It's been my pleasure. Thank you, and I hope you enjoy the rest of the day.
Thank you.
Thanks very much, Jack.
Thank you. David, I'm sorry to bother you, but I tried to put something in chat and found that it was disabled. Is that just me?
The chat is I didn't disable it, but
okay.
I think it's one of the options that the synagogue's taken.
Oh.
Don't ask me why. I think they're frightened that people might put disreputable comments up or disturb the.
I'm not sure. It look on my screen. It looks all right. That I type message.
Yes, it does on mine as well. It's okay.
But mine says chat disabled. So I just want.
Well, let's see what I do if I just send that.
Mine says ask the host to give you permission.
Yes,
Judy to everyone, hi. Me to Judy, good. At the moment, between Judy and myself, it's working.